Hello.
Hey doctor, thank you for coming. So we have a 74-year-old female with a history of COPD and hypertension. She is post-operative day 4 after cholecystectomy, and we came to find that she is an alteration in her mental status and she's not sitting well. Can you please help us?
Oh, okay, yeah, sure.
Her name is Mrs. Lopez.
Mrs. Lopez. Okay, Mrs. Lopez. Mrs. Lopez, can you open your eyes? So she's not really responding. Is she like that?
She's been like that for an hour.
Okay. So I'm checking her oxygenation is low and she's febrile, so she might be septic. First, let's make her sit up some. And do you mind, like, could you please give me oxygen
Yeah. What would you
face
like?
mask, non-rebreather?
Okay. Here you go.
Okay, thank you. So we'll do non-rebreather here.
What flow?
Let's put on 10 liters.
Okay.
Okay. So now in the meantime, we can start IV fluids. So we're giving like 1 liter bolus of IV fluid,
Okay.
and she's still very tachypnic and not responsive. I think we may have to intubate if she doesn't respond to oxygen, if her saturation doesn't come up. So let's activate the team for respiratory therapist and ICU. Tell them that there will be a patient coming who is not responding to oxygen therapy, and she is hypotensive. Most likely she is in septic shock. So, and
I'll reach them right now.
okay, and get me this ambu bag, please. Miss Lopez? Yes, she's still not responding. So we have to support her oxygenation and her breathing. She looks like she's very tachypnic and working hard to breathe. And when I'm working on the ventilation and oxygenation, could you please give me the laryngoscope and endotracheal tube?
Yep.
Okay, thank you. So now that she's already unconscious, I probably don't need to give her any sedatives. But could you please make sure that I have suction available?
Yeah. Suction's right here.
Okay. Great, thank you. I will take it here. And we'll drop the bed down, like make it flat.
Okay.
Okay, that's good, thank you. Okay, now the saturation is 95, so I'm going to intubate. Have some lot of secretion. Okay, getting the endotracheal tube. Okay, let's connect this to the ambu bag to make sure this is in the right place. And could you please also give me the CO2 detector? Let's inflate the cuff. And we'll make sure that there is a color change. Okay. All right, there's color change, so to chest rise. So endotracheal tube is in the right position. Now we have to get the respiratory therapist involved. So we have to transfer this patient to ICU to put the patient on the ventilator. In the meantime, I would like to have the chest X-ray, CBC, CMP, arterial blood gas, and EKG ordered.
Okay. We'll get those right away.
Okay, and also we need to do pan culture. So we'll culture her blood, urine, and sputum, and start him on start her on vancomycin and cefepime antibiotic
Okay.
as empiric treatment.